What's up, you guys? It's your boy Miguel here to give you your daily dose of radiation. In today's video, we are covering the medical terminology in the world of radiology. So, to give you context, I'm a night shift X-ray tech. Been doing it for over 4 years. I work at a Trauma 3 in the great state of Texas. So, I know when you're going through school, you're like, you see all these big words. Now, if you're debating if you're going to be a nurse or you're going to be an X-ray, just know if you're a nurse, you will be involved way more in these fancy words than we do as X-ray techs. Our profession, we do have some big words. We do have some complicated medical terminology, but it all boils down to what you need me to do. What do I have to X-ray? Because the order can say post-thoracentesis, or it can say post-barium study, or any medical term. And what you're looking at, even if you don't know what the reason is, sometimes you would like to know the reason just so you can physically know kind of what you're getting into, how you may have to adjust your exam based off of the reason, or to make sure no artifact, or to make sure that whatever's there is actual medical device. You know, there's certain stuff you have to know. But most of the time it's like, is it a chest? Is it a hip? Is it that? That's kind of, or the abbreviations, like a chest x-ray can just be a CX, like, or a hip x-ray, like the abbreviations of it. Or sometimes the doctor will be like, oh, give me a CTL. And you're like, okay, C-spine, T-spine, L-spine. Or they'll use a bunch of abbreviation, like the reason will be CP, chest pain, or the history, or it'll be like history of fractures, but it'll be abbreviated. It's just like simple terms, nothing too crazy. Sometimes you will be like in the trauma room, or you'll be in the patient room, and like the doctor will be telling me like some history of the patient, and the whole time I don't know half of the words that he's saying, because like he'll say some medical words. I'm like, I've heard of these words, but I don't know what they are. But then he's like, I'll just give me a chest x-ray. And I'm like, that's all I needed to know. So don't feel bad if you're struggling with some of the medical terminologies. Obviously, there's certain ones that you should know, like pneumothorax, hemothorax, like certain big words. Well, not too big, but just like medical terms. Because if you see a pneumo, that can be like a life or death type situation if you don't get someone to check it out quickly. So there are certain words that are more important in our field and that you should know about. I'm trying to think about what other ones. I mean, everything gets ordered stat, which, is it stat at that point? Let me see what else we got. I mean, other medical words-ish, they'll, like, I know during the nighttime, especially can't confirm or deny post-naps, when they'll call me, and I'll be on the phone with, like, a nurse, and they're like, hey, I'm in so-and-so location. And I'll think about it, because most nurses say the abbreviation of where they're at. They'll be like, ICU, SICU, so surgical intense care unit, or intense care unit, or what other, wherever they are. Because some is like cardiac something, or neuro, or forgot what other ones. They'll use like the big terminology, and in my brain, can't confirm or deny naps. We'll like answer the phone, and I'm there struggling to like, I was like, give me a number, west, east, where am I going? You're doing too much, ma'am. But I think that's just mainly me in this dreaded night shift I find myself into. But overall, you don't have to really be scared about all these medical words. I will say that sometimes speaking with doctors in other medical professions, if you talk in regular terms, sometimes you get made fun of. Because, like, I don't know about how y'all operate or what y'all do. I'm there to just push the button. I'll give you the more simplest, plain term. Like, they'll be like, oh, Miguel, we need this. Or I'll be like, hey, can you order me an x-ray of, sometimes I'll say KUB. Sometimes I'll be of their tummy or of their stomach because I got little kids. Like, basic words, and sometimes they'll just laugh at me because of, like, the way I say it. But, like, I'm not there to flex on anyone on medical terminology or even on the patients. You don't got to do all that, because some of these people, you'll tell them, like, oh, we're doing this exam, and they'll be like, huh, like, what? And then you'll just quickly be like, of your stomach, or of your tummy, or of this, or of that. Like, keep it like in the most simplest terms. So with like patients, you don't have to use these big. Certain people would rather have the big medical words. So you do have to know those too. Or not even knowing what they are, but knowing how to pronounce those words is what I always get in trouble, because I'm dyslexic. So it's like sometimes the patients on the floor will ask, why am I getting this exam done? And I'll look at the reason, and I'm there like, it's a bunch of abbreviations that I don't know. Or, it's this big medical word that I don't know. So I like quickly think what it is or other synonyms. That's mainly where I get myself in situations. But usually it's a chest x-ray, and usually I'll just observe if they have a chest tube or they have whatever going on, and I'll be like, right there, that's a good reason of why to get a chest x-ray or why we're doing this. So that's more of where some of the terminology could come useful. But overall, it's not too bad. I know my lady, who is a nurse, is different over there. And they got to know all the medical words. Even with the medicines and all that, it can get a little bit crazy over there. I've seen the charting, and I've seen all of the other lingo they use. It can get more hectic over there. So it's been your boy Miguel. I'm about to clock in to push the button. I'll see you on the next one.